Hello everybody, so my name is Susanna Shimoleski and I am doing a plan change process assessment on my client Billy Little Rock, who lives at the Francetis Children's Home in Missoula, Montana. So here's a little background on Billy. So Billy is a 12-year-old male Native American student who is currently attending a local middle school in Missoula, Montana, and he's in the 6th grade. He is currently living at the Francetis Children's Home in Missoula, Montana. Billy has been involved with Child and Family Protective Services since the age of 5. He was removed from his current living situation because it was very unstable and unsafe. Billy's parents, Steve Little Rock and Jessica Little Rock, suffer from historical trauma, and because of this trauma, struggle with addictions. Alcoholism is their main addiction. They have been homeless in the Missoula area all of Billy's life. Billy's parents lost all parental rights when he was attending the Francetis Children's Home. Family therapy sessions occurred every 2 weeks. But after a month, the family stopped going and didn't take any steps to improve their current living situation and addictions. Billy has been placed in 4 different group homes. The Francetis Children's Home is the first therapeutic group home that he has been placed in. Billy was also placed with his aunt, Lily Peterson. She lived on a Native American reservation also in Montana, and she has 2 children, Jake and Christy. Due to Billy's parents experiencing homelessness, Billy saw a lot of things that he shouldn't have seen, a lot of sexual behavior, and unfortunately, Billy was raped. So Billy attempted sexual intercourse with his cousin Jake 2 times and his cousin Christy once. And Lily couldn't handle the sexual abuse her children were facing and placed Billy again with Child and Family Protective Services. Billy has been diagnosed with depression, PTSD, and general anxiety disorder. Billy was referred to Francetis Children's Home because he had severe anxiety around adults and was experiencing PTSD episodes 2 to 3 times a week. Billy has been at the home for 6 months. He has built strong relationships with many of the staff members and especially an attachment counselor, John Anderson. Billy does extremely well in school and is very good at wrestling, soccer, and basketball through his school. Billy also is a very talented artist. He expresses many emotions through his art, and Billy currently has a foster family, Mike and Kathleen Potter, that are extremely interested in providing Billy with a safe, secure, loving home. On May 5th, Billy had a PTSD episode lasting around 30 minutes. He did not trust an attachment counselor working at the home because she wouldn't allow him to look at pictures from a Christmas party. He believed that the pictures might have involved alcohol, and that is why he began to not trust any of the adults at the home because he assumed that they all could drink alcohol, and to him, alcohol is associated with neglect. So he closed the bathroom door shut on us, and then after that, we got him into his room and just to help calm him down, and he threatened us with a belt, so we called supervision because we really weren't sure what to do at that point. And Billy has Billy has done pretty well after that episode, and he currently has a family who is very interested in him. Billy's sexual behavior has also improved since being at the home. He now lets adults know when he is having sexual feelings. Billy will be placed in his foster family within 6 months. Billy is having anxiety leaving Francetis because it is a place he feels secure, loved, and safe. He is not listening well and thinks progress doesn't matter because he is leaving. So the first phase of the plan change process is the engagement phase. And in this phase, the perspectives that I will be using are diversity perspective, ecosystems perspective, and the strength perspective. So in Billy's case, the diversity perspective will be used to understand Billy and his current situation, and also use the perspective to help understand PTSD, anxiety, and depression. And the ecosystems perspective will be used to understand how Billy's past social environment influences him, and also look at interactions he also experienced and how those influenced him. The strength perspective will be used to focus on strength in order to define assets. And the following skills that were used during this assessment were both open-ended questions, active listening skills, furthering, paraphrasing, and summarizing. The assessment phase is the next phase of the plan change process. The orienting theories used in Billy's plan change process include strength-based theory, family systems theory, behavioral theory, and trauma theory. So the strength-based theory, Billy does well in school, which is good. He loves sports, and he's pretty good at them. He is a talented artist, excited about a new family, embraces his Native American culture, has been forming strong relationships with adults, and is honest and open about sexual feelings. Family systems theory is the next theory used. So Billy's biological parents influenced him significantly. This theory should be looked at in understanding Billy and the skills he needs to continue to grow in. Behavioral theory is used. Billy's sexual behavior has improved significantly since living at Francetage. Billy is scared to leave Francetage because it has provided him a secure, loving, safe environment. He is acting out towards adults because he is afraid to leave. The trauma theory is used because Billy has clearly been through a significant amount of trauma, such things like his parents losing parental rights, sexual abuse, and homelessness, as well as his aunt bringing him back to Child and Family Protective Services because she couldn't handle him. He needs to identify and address these traumatic events and the importance of successful healing. So the way that the data was collected, organized, and interpreted was through logs, which we do at the Francetage. The logs consist of both goals and objectives for the clients. The data is organized by day. It is interpreted by knowing what Billy's daily objectives are and if he has met them with a point system. So there's +1, +2, +3, +4, and so on. The therapist Case Shelby at the therapeutic home also takes notes on Billy. Strengths. Billy is willing to work hard to reach his desired outcomes. He is resilient. He has a foster family that wants to address his needs. He understands culture identity. He is open and honest, and he has better control over his anxiety, does well in school, and performs strong in sports. Some limitations for Billy is that he does not really understand the concept of drinking in moderation. Drinking is a huge trauma thing for him. He associates drinking with neglect. Billy gets PTSD attacks from hearing or seeing alcohol. Billy is acting out because he is afraid to leave Francetage, and Billy's sexual behavior scale is quite high. It's an 8 out of 10 right now. The interventions theories used in Billy's plan change process are behavioral model, motivational interviewing, crisis intervention model, and client-centered model. The behavioral model is used because Billy is working on being aware of his body. He is working on letting adults know when he has sexual feelings as well as major anxiety about situations. Billy will continue working on learning how to self-control and talking to adults to calm down his body. Motivational interviewing is used because Billy has experienced things such as homelessness, rape, a non-secure home, and seeing substance abuse. Billy is very talented in sports, art, and is a good student, even though this has happened to him. Billy is resilient, and Billy knows practice and working hard shows positive change. Crisis intervention model is used because Billy has experienced high levels of trauma. He was removed from his parents, his aunt removed him from his care, and his parents lost parental rights. He experienced sexual abuse and experienced extreme neglect. This model will be used to help address traumas and therapy-centered care to address these traumas. The client-centered model is the next model used. So Billy wants to live with his current foster family. Billy has found interest in sports and arts that have helped motivated him in leaving the Francetage house. Billy's goals in the next 6 months are to identify sexual feelings, address anxiety with staff, and to seek closure with family. So goal 1 of his treatment plan is Billy will continue developing regulation skills by practicing his coping skills on his own. Staff will encourage Billy to use regulation skills that he has learned in the house when Billy is under emotional distress. Staff will continue to praise Billy when he is able to self-regulate, and after Billy has calmed down, staff will discuss what types of skills were used and practice them with Billy when he is feeling emotional distress. Goal 2 of his treatment plan is Billy will begin to identify future emotional triggers and potential strategies for coping with these events. And so staff will help Billy learn coping strategies based on current coping skills. Staff will continue to develop and make space for child-centered activities when Billy is in a regulated place, and staff will continue telling Billy what regulation skills he has learned when Billy is under emotional distress. Billy will be evaluated by both staff and therapists on whether he has achieved most of these goals. He will continue working on goals during his time at the Francetage. With 6 months, he will be placed with his foster family. Also, at the end of his placement at the Francetage, he will fill out an evaluation form that will basically just describe his experience at the Francetage Children's Home and the goals that he feels like he has accomplished there. Anyways, thanks very much for listening. Bye-bye.